So it's
Dr. Sandeep Buddhiraja, what's the preparation at your setup at Max Healthcare? How many doctors and medical staff willing to sign up, and how many just want to let the others go first and see what happens?
So Rahul, I would fully echo the sentiments voiced by Dr. Trehan, and I think it's a silver lining day which all of us as healthcare workers and in fact as citizens have been waiting and looking forward to. So we have at Max Healthcare 5 vaccination centers in Delhi NCR, which will be catering to initially the healthcare workers in our group of hospitals, which are over 15,000 healthcare workers. And the initial impression which I have is most of them, a large majority of them, are absolutely waiting for the vaccination and be participative of that. Just on the same lines as Dr. Trehan mentioned about a potential study, we are also conceptualizing a detailed study of all the healthcare workers who get vaccinated and follow them up over next few weeks with their serial antibody and a potential adverse effects, if at all. And this entire set of information, I think, pooled from various organizations, ultimately will add to a very valuable academic pool and data on which to sort of base the effect of vaccination and how long the immunity lasts.
Okay.
I think this is a very, very important day for all of us. And as Dr. Trehan rightly said, hopefully a beginning of the end.
Now, I have a question, Dr. Trehan, about the second dose. Now, from what I have figured from the manufacturers and the researchers at Oxford and AstraZeneca, is that they now believe, post the latest round of research, that the second dose is more efficacious or creates more immunity after a period of 8 to 12 weeks, which is 2 or 3 months later. However, the government of India at this time is saying that the second dose should happen 28 days later, which is what the first set of trials was done for. And I understand that that's the data they got and that's the approval that's been granted, but from the perspective of a layperson, I say if the researchers who made the vaccine and the company which is producing it thinks that I'm better off if I take it after 2 or 3 months, then why should I take the second dose after 28 days? What's your view on that, Dr. Trehan?
So I think we should go with 28 days. First of all,
why?
You know, there is a big gap between your immunity does not kick in till the second dose is given, the booster is given. So you are exposing yourself for the next 2-3 months into the same state that you were before you got the first shot. So basically, 28 days is the largest number of people who were studied. Now, you know, new things come and keep confusing the issue. There are many factors behind it. Countries have said, okay, we are finding it difficult to inoculate, we need that many doses. So maybe by extending the period between 2 doses, maybe we'll be able to vaccinate more people quickly. Which is a methodology, but you don't know in large numbers over a long period of time that does that 2 to 3 month extension work better, reliably, or we are just going on spec. So today I support the government of India's decision that let's go with 28 days, let's get the population vaccinated. We have the ability to vaccinate a lot of people. There has been a lot of preparation that's gone in. I'm hoping and I don't think there will be chaos like has happened in some of the other countries. America is a total chaos. So if the planning that we have put into place and the protocols that are in place, if we stick to them and practice them properly, we will be able to do maximum number of vaccinations. And as you know, this is being manufactured in India, the Serum Institute.
And you're making an important point, because I just picked up an interesting data nugget. So far, American company Moderna has sent 9 million doses in the entire month and more that the vaccination's been on in the United States, Dr. Buddhiraja, whereas in India already, in the first dose itself, in the first batch itself, from one company in Pune, we were able to send 11 million doses, which shows that unlike, you know, what people may think, those who don't like the way things operate in India or outside naysayers against India, we actually have scale and planning of a level that hasn't been seen even in countries like the United States.
Absolutely, Rahul. In fact, if you see the original thought process in US, they were planning to vaccinate 20 million people before the new year, by the end of the last year, and they managed to do only 2 million vaccinations. So I think across the world, there is no comparison between the way Indians can scale up the production of vaccine. And I think this is a moment for all of us to feel really proud of ourselves that we have managed as a country to not only produce an indigenous vaccine, that's the Covaxin, plus also be the largest producer of Oxford vaccine, and we are the potential suppliers to half of the world.